Hi everyone, how are you today? Welcome back. And if you are new here, welcome to my channel where you can learn the real world coding experience. And this is Han, the coding expert. If you want to pass any coding exam to start your coding career, or if you are already holding a coding credential, working in the field, and want to learn more in order to advance your coding profession, then you are in the right place. I hope that you are all enjoying the last days of summer and recharging your learning enthusiasms. In 2 weeks, the summer is over, school is back in session, and September is a great time for reinvention and renewed motivation. Science says September is the best time to set big goals. Ask yourself what I want to achieve this year that I have not started. Well, for many of you, I guess the answer will be I want to pass the coding exam and start my new career profession, or I want to be the best coder so that I can get promoted at work. If that is your answer, then what are you waiting for? Do not sit still and wait or wander around and take no action. You should open your books, watch my videos, and do some coding now. At the end of the day, you at least know how to code some surgery or procedure cases. Those who have been watching my videos have already passed the exam successfully and continue to learn to excel their coding career. For those of you who are new to coding and are preparing for the coding exam, all I can say is you sure can do it. I wish you all the best. Today's topic is CPC, COC, CCS, and CCS-P exam prep in 2021. The auditory system. You have a chance to code surgeries and procedures that are related to the ear, which you need to know for the exam and also for work, especially if you are coding for an ENT, ear, nose, and throat department. Alright, without further ado, let's get started. Before we start, I would like to go over the basic anatomy and physiology of the ear, so that you should have an idea how the human ear works. The ear is the organ of hearing and balance. The parts of the ear include the external or outer ear, second, the middle ear, and third, the inner ear. The external and outer ear consisting of pinna or auricle. This is the outside part of the ear. The external auditory canal or tube. This is the tube that connects the outer ear to the inside or middle ear. The tympanic membrane or eardrum. The tympanic membrane divides the external ear from the middle ear. The middle ear consisting of ossicles, 3 small bones that are connected and transmit the sound wave to the inner ear. The bones are called malleus, incus, and stapes. The eustachian tube, a canal that links the middle ear with the back of the nose. The eustachian tube helps to equalize the pressure in the middle ear. Equalized pressure is needed for the proper transfer of sound waves. The inner ear consists of the cochlea. This contains the nerve for hearing. The vestibule. This contains receptor for balance. And semicircular canal. This contains receptor for balance. Hearing starts with the outer ear. When a sound is made outside the outer ear, the sound waves or vibration travel down the external auditory canal and strike the eardrum, tympanic membrane. The eardrum vibrates. The vibrations are then passed to 3 tiny bones in the middle ear called the ossicle. The ossicle amplify the sounds. They send the sound waves to the inner ear and into the fluid-filled hearing organ, cochlea. Once the sound wave reach the inner ear, They are converted into electrical impulses. The auditory nerve sends these impulses to the brain. The brain then translates these electrical impulses as sound. Alright, that should be enough for the basic anatomy and physiology of the ear. I'm ready for question and case study. Are you ready? Let's do it. Question number 1. What is the correct CPT code to use for the procedure biopsy of external auditory canal? I put on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CPT book, if you look under the main term, biopsy, auditory canal, external, it will give you just one code, 69105. Your next step is to duplicate this code in the tabular list, and here's what you get. 69105, biopsy, external, auditory canal. And this is the right code to use for this procedure. That said, the correct answer to this question is 69105. Question number 2. What is the correct CPT code to use for this procedure? Myringotomy with PE tube, pressure equalizing tube insertion. Inflammation of the middle ear occurs because of infection. It causes fluid accumulation and leads to pressure, pain, and sometimes loss of hearing. Myringotomy is a surgical procedure to treat inflammation in the middle ear and involves making an incision in the eardrum or tympanic membrane to allow fluid to be suctioned out from the middle ear. This may be followed by the insertion of a tube that helps drain the fluid of the middle ear. This procedure is commonly performed in children since ear infection in adults is usually not persistent. I will put on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CPT book, if you look under the main term, myringotomy, it will give you two codes, 69420 and 69421. And if you check these available codes in the tabular list, you find out that these two codes have nothing to do with the insertion of the PE, pressure equalizing tube. So you should write a note in your book in red that do not use this code for this procedure. Having said that, you should look under the main term, tympanic membrane, stoma. Stoma means an artificial opening made into a hollow organ. In other words, an incision is made for the PE tube insertion. CPT will give you three codes, 0583T, 69433, and 69436. 0583T is a Category 3 code for Medicare payer, so I don't want you to worry about it for now. Just focus on the other two codes, 69433 and 69436. Your next step is to check these available codes in the tabular list, and here what you get. 69433, tympanostomy requiring insertion of ventilating tube, local or topical anesthesia. 69436, tympanostomy requiring insertion of ventilating tube, general anesthesia. Based on the question, general anesthesia is not documented, so we cannot use 69436. That said, the correct answer to this question is 69433. Question number 3. What is the correct CPT code to use for this procedure? Removal of bead from a child's external ear canal using conscious sedation. I will put on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CPT book, if you look under the main term, removal, foreign body, auditory canal, external, it will give you just one code, 69200. Your next step is to double check this code in the tabular list, and here what you get. 69200, removal foreign body from external auditory canal without general anesthesia. 69205, this is unidentical, so it includes all the information from the code above. 69200, which is the parent code, except 69205 is performed under general anesthesia. And just in case you don't know, conscious sedation is not the same as general anesthesia. The purpose of conscious sedation is to reduce anxiety, discomfort, and pain during procedure. It lets you stay awake and aware. This is accomplished with medication and sometimes local anesthesia to induce relaxation. On the other hand, in general anesthesia, you have a complete loss of consciousness, and it means that you will not feel, hear, or remember anything. Now go back to our question. There is no document of general anesthesia, so we cannot use 69205. That said, the correct answer to the question is 69200. Question number 4. What is the correct CPT code to use for this procedure? Removal of impacted cerumen, also called earwax, bilateral with instrumentation. I will put on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. Now, if you look under the main term, removal, cerumen, auditory canal, external, it will give you two codes, 69209 and 69210. Or if you already know, then just go directly to the main term, cerumen, removal with instrumentation, it will give you just one code, 69210. Your next step is to double check this code in the tabular list, and here what you get. 69210, removal, impacted cerumen requiring instrumentation, unilateral. And this is the right code to use for this procedure. However, based on the code descriptor, it is for a unilateral procedure. According to our question, the procedure is performed on both ears bilaterally, so we need to attach modify 50 for bilateral procedure to 69210. That said, the correct answer to this question is 69210 modify 50. On another note, removing cerumen or earwax that is not impacted does not warrant the reporting of CPT code. You have to use the e-name code instead, and the e-name code will depend on where the service takes place, for example, in the emergency room or hospital observation unit. For those of you who is planning to take the CCS exam, which is the hardest exam to pass, and that is why CCS credential is considered the gold standard for facility or hospital coding. It is a mastery level credential and not for the novice coder. In order to pass the CCS exam, you have to know the RC10CM code set, the RC10 PCS code set, and CPT HICP code set. Also, unlike CPC exam, in addition to the multiple choice questions, the test also includes a fill in the blank portion. In other words, you have to know the surgery and procedure very well in order to look up the right PCS code for inpatient cases and CPT code for outpatient cases. And I am trying to bring you up to that level. I have a plan, and slowly but surely you get there if you stick with me. Question number 5. What is the correct CPT code to use for the procedure? Repair of tympanic membrane perforation using synthetic patch. I will put on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CPT book, if you look under the main term, repair tympanic membrane, it will give you two codes, 69450 and 69610. And if you look under the main term, tympanic membrane, repair, it will give you just one code, 69610. So this is the fastest route to go. Your next step is to double check this code in the tabular list, and here's what you get. 69610 tympanic membrane repair with or without site preparation of perforation for closure with or without patch. And this is the right code to use for this procedure. That said, the correct answer to this question is 69610. Question number 6. What is the correct CPT code to use for the procedure? Implantation of cochlear device. A cochlear implant is an electronic device that partially restores hearing. It can be an option for people who have severe hearing loss from inner ear damage who are no longer helped by using hearing aids. Unlike hearing aids, which amplify sound, a cochlear implant bypasses damaged portion of the ear to deliver sound signal to the hearing auditory nerve. All cochlear implants, regardless of manufacturer, consists of two general components: the receiver stimulator and the intracochlear electrode. The processor captures sound signal and sends them to the receiver implanted under the skin behind the ear. The receiver sends the signal to electrodes implanted in the inner ear cochlea. The signal stimulates the auditory nerve, which then directs them to the brain. The brain interprets those signals as sounds. I will put on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CPT book, if you look under the main term, implantation, cochlear device, it will give you just one code, 69930. Your next step is to double check this code in the tabular list and hear what you get. 69930, cochlear device implantation. And this is the right code to use for the procedure. That said, the correct answer to this question is 69930. Question number 7. What is the correct CPT code to use for the procedure? Transcanal, labyrinthectomy with mastectomy. I will put on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CPT book, if you look under the main term, labyrinthectomy with mastectomy, it will give you just one code, 69910. Your next step is to double check this code in the tabular list. And because 69910 is an indented code, so I will show you its parent code. 69905, labyrinthectomy, transcanal. 69910, this is an indented code, so it includes all the information from the code above, 69905, which is the parent code, except 69910 is performed with mastectomy. And this is the right code to use for this procedure. That said, the correct answer to this question is 69910. Just a friendly reminder that if you enjoy what you have learned so far and appreciate my time spent for this video, then you could please pause the video, click the like, subscribe and share buttons below now to support my channel, and that would be great. Instead of working overtime on the weekend to earn extra money or spending time with my family, I have used my valuable time to prepare for this learning video. As a result, I have no time left for myself. I'm doing it because I really want you to do well on the exam and also to have more confidence at work. Your comments about my videos and your continued sharing your good news with me right after passing the exam really inspires me and makes me want to do more. Thank you so much for your support, and we should move on to the next question. Question number 8. What is the correct CPT code to use for the procedure? Simple debridement of mastoid cavity. I will put on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure, please pause the video and do it now. Alright, let's see how you did. In the index in your CPT book, if you look under the main term, debridement, mastoid cavity, symbol, it will give you just one code, 69220. Your next step is to double check this code in the tabular list, and here what you get. 69220, debridement, mastoidectomy cavity, symbol, and this is the right code to use for this procedure. That said, the correct answer to this question is 69220. Question number 9. What is the correct CPT code to use for this procedure? Decompression of internal auditory canal. I will put on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CPT book, if you look under the main term, decompression, auditory canal, internal, it will give you two codes, 61591 and 69960. Your next step is to review these available codes in the tabular list, and you find that 69960, decompression, internal, auditory canal. And this is the right code to use for the procedure. That said, the correct answer to this question is 69960. Question number 10. Before we tackle this case, it is very similar to what you will see on the CPC coding exam. It is a multiple choice question. And if you have been watching my training videos, then you should know my backward approach. Instead of reading the procedure report first, which you don't have enough time during the exam, and also, you may or may not have a clue what you are reading or what surgery or procedure that they are doing if you are not a coder or never coded this type of surgery or procedure before. Not to mention, when you read a 1 or 2 page long procedure report with so many technical terms that you don't know, then you feel nervous and panic, and as a result, you will lose your focus during the exam. My backward approach is to analyze the answer first, and then read the procedure report after. This technique will give you an idea what surgery or procedure is performed by looking at the CPT code description, and I am the only one who tackle coding exam this way. Follow my tips and strategy. A, B, C, and D all have the same code, 69930. However, A and B have no modified 50, so I put them in the same group. C and D have modified 50 for bilateral procedure, so I put them in the same group. Now you know, there is only one code for you to look it up in your CPT book, which is 69930. Please pause video and do it now. Assuming you already look it up in your CPT book and here's what you get. 69930 cochlear device implantation. Now you know, this case is about the cochlear device implantation, and based on the code description, this code is not described as bilateral procedure, so you know your focus should be what is to find out whether a unilateral or bilateral procedure is performed. Let's read it. A 50-year-old patient with decreased hearing decided to undergo bilateral cochlear device implantation in order to restore his hearing. Based on what I just highlighted, this patient was having a bilateral cochlear device implantation, so we need to use modified 50 for bilateral procedure in this case. That said, we can eliminate A and B from here. C and D still remain, and the only difference between C and D is that C has 69505, which D doesn't have. So please open your CPT book and find out what it's for. Assuming you already look it up in your CPT book and hear what you find. 69505 mastectomy modified radical. Let's continue reading the procedure report and find out. Due to the position and the size of the device, the physician performed a modified mastectomy. A mastectomy was necessary for the completion of the cochlear device implantation procedure. Based on what I just highlighted, a modified mastectomy was performed in order to accommodate for the size of the device. So I know you would think, of course, C must be the right answer, no brainer. But please, wait for a second. I chose this case for a purpose, because I know some of you will make the same mistake to assign 69505 modified mastectomy as an additional procedure. If you code it in the real world, it will be considered unbundling. In order to implant this device, the surgeon will make a cut or incision behind your ear and form a small hole in the portion of the mastoid skull bone, and it's called mastectomy, where the internal device rests. The surgeon will also create a small opening in the cochlea in order to thread the electrode of the internal device. That said, this code 69930 already includes the work of cutting the small mastoid bone or mastectomy in order to accommodate the size of the device. So 69505 should not be reported separately. That said, the correct answer to this question is 69930 would modify 50 for bilateral procedure. You should write a note next to this code 69930 in your CPT book that it already includes mastectomy, just to remind you. Question number 11. Follow my tips and strategy. You don't read the procedure report first. Instead, focus on the answer and analyze them. The CPT code description will give you an idea what surgery or procedure that they are doing. That said, if you look at this answer, A, C, and D all have the same code, 69436, so they are in the same group. B has a different code, 69433, so it is in a separate group. Now you know there are two codes that you need to look up in your CPT book, 69436 and 69433. Please pause the video and do it now. Assuming you already looked them up in your CPT book and hear what you get. 69433 tympanostomy requiring insertion of ventilating tube, local or topical anesthesia. 69436 tympanostomy requiring insertion of ventilating tube, general anesthesia. Follow my tips and strategy. You highlight the main difference between each CPT code, and when you're done, you could tell the only difference between these two codes is that 69433 is performed under local or topical anesthesia versus 69436 is performed under general anesthesia. Now you know what your focus should be when you read the procedure report. Let's read it. The physician performed a bilateral tympanostomy with placement of drainage tube in a 10-year-old female who required general anesthesia. Based on what I just highlighted, a bilateral tympanostomy with tube placement is performed under general anesthesia, so 69436 with modified 50 attack should be reported. That said, we can eliminate B and C from here. Now, A and D still remain, and the only difference between these two answers is that A has 69020 and D has 10060. So please open your CPT book and look up these two codes, 69020 and 1060, to find out what they are for. Please pause the video and do it now. Assuming you already looked them up in your CPT book, and here what you get. 69020 drained external auditory canal abscess. 10060 incision and drainage of abscess, subcutaneous abscess, cyst, furuncle, or paronychia, symbol or single. Follow my tips and strategy. You highlight the main difference between each CPT code, and when you're done, you could tell the only difference between these two codes is that 69020 is for incision and drainage of the external auditory ear canal versus 10060 is also for incision and drainage, but it is applied to the skin and subcutaneous tissue, cyst or paronychia, etc. Now you know what your focus should be when you read the procedure report. Let's continue reading. During the procedure, a large abscess was noted on the right external auditory canal. The physician inside and drained the abscess and placed ventilating tubes in each tympanum. Based on what I just highlighted, a large abscess was noted. It is considered an incidental finding, and the incision and drainage of the external auditory canal abscess was performed, so 69020 is the right code to use for this procedure. That said, the correct answer to this question is A. 69936 with modified 50 attached and 69020. I hope that you learned something new and valuable for coding today. That is all for now. Thank you so much for watching, for liking, and sharing this video. If you find this video is helpful, informative, and easy to learn with this format, or if you have any suggestion, then please leave me a comment below just to let me know. I really appreciate it. Also, the more positive comments that you leave for me, the better chance for my videos will be reviewed by other people. So please continue to do so. Until next time, have a great day.